Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And you're in for a treat because we're honored to have with us Dr. Michael Golinko. He is the Delta Dental of Tennessee Smile 180 Foundation Director of the Cleft and Craniofacial Program, Chief of Pediatric Plastic Surgery, Monroe Carell Jr. Children's Hospital, Program Director of the Craniofacial Fellowship, Associate Professor of Plastic Surgery, Oto-Head Neck Surgery, and Neurosurgery at Vanderbilt University Medical Center. That is a lot of amazing titles, but Dr. Golinko, how are you doing, buddy?
Doing great, man. I'm just a regular guy from Brooklyn, New York. Just want to put that out there. So, not too scary, but thanks for the introduction, Jeremy. So yeah, really happy to be here with everybody and your listeners. Really excited to kind of showcase, tell you about our program a little bit and everything that we're kind of getting engaged with the community. So happy to be here.
Well, when you talk about that many titles, that many responsibilities, it means you're doing a lot of good. And so you and I had a chance to meet originally with Delta Dental of Tennessee, the Smile 180 Foundation, and that is a big part of this storyline. But for starters, give us a little bit of your background, and then we'll tie all that into the amazing good you're doing.
Sure. Well, it all began when I was with seeing a patient when I was a medical student. So kind of had an inkling I wanted to do something surgical. Saw my first plastic surgery when I was a third-year medical student in Tampa. So went to med school in Tampa, grew up in New York, but went to med school in Tampa. And I was on my surgery rotation down there at USF at All Children's Hospital. And there I had a mentor, Dr. Michael Gallant, who was a plastic surgeon that did cleft lip and palate. And he showed me what is now still wondrous to my eyes and almost like magic, but my first cleft lip operation on a little baby. Can still remember it. And he's like, look at this and all these little markings, these tiny markings you're operating on the child's lip and nose as an infant, typically at 3 months of age when we were kind of repair and reconstruct the lip and the nose. And it's all these tiny little geometrical markings. And I just thought it was like the most magical thing I'd ever seen. And I was like, oh my gosh, I have to do this. Like I have to figure out a way to do this. And it sent me on a very long circuitous pathway, around the world, around New York, to basically general surgery in New York City. I was a downstate there for a number of years, did research at Columbia, finished surgery residency in general surgery at NYU, and then went down to Atlanta, which brought me into the SEC fold, if you will. It made me a believer in SEC football. Brought me into the fold at Emory Plastic Surgery, and then I spent my final year of training doing pediatric plastic surgery, which was my career goal, always to take care of these children in this population back at NYU. From there, I had my first job at Arkansas Children, so not too far away in our adjacent neighboring state. Was there and led the craniofacial program for about 3.5 years, and then luckily got recruited to Nashville, where we love it. This is our home, our life. We're lifers here. We're all in. So that's kind of in a brief nutshell, but it had been Vanderbilt now almost 6 years.
You kind of described the cleft craniofacial, and this will lead us into the program and your team. And as you alluded to, a very difficult circumstance at birth, but being able to create transformation and what that means for the child and their family, for their health, for their smile, their professional career. Like there's a lot in terms of what this transformation entails. And so talk about kind of the health side, the pride side, some of the things that you're doing to really step in and transform lives.
Yeah. Obviously for anybody that's seeing kind of, a poster or a smile train thing with the kid with cleft lip and palate, it's kind of in a very central part of the face. And as you alluded to, it's not only something we see, but obviously any kid with a facial difference, but particularly cleft lip and palate can affect speech. And that actually, Jeremy, can be more impactful. Just the simple conversation we're having now and being understood. These are something that our kids can often struggle with. And so we all want to be seen, but we also want to be heard too. Which kind of dovetails into kind of our comprehensive program of how we address all these kind of challenges or little road bumps that these kids may face over the kind of years. So our program is designed to really establish that relationship with the family, really even before the baby is even born. So once kind of mom has her anatomic ultrasound at 24 weeks, our team will kind of swoop in, really kind of reassure the parents and the caregivers that, hey, everything's going to be fine. We have a great community here in Middle Tennessee that has kind of walked this path before, kind of guiding them through the uncertainties, the fear of like, I have a child with a cleft, for example. What does that mean? Are they going to be normal? Are they going to be like every other kid? So these are a lot of the fears that we have to allay when we meet these parents for the first time. I think we're very fortunate at Vanderbilt to have a really comprehensive team. So we call it kind of prenatal to pension, basically. It was prenatal to prom, but we can see kids well through adulthood too. So it's prenatal, prom, pension. So essentially, we can see them through their entire spectrum of their adult life too for any needs that come up, and they do come up. But basically, our goal at that first meeting is to kind of get a lay of the land. We have a little anatomic picture on the ultrasound, so you can often see the cleft lip or palate sometimes. And then they may meet one of our providers, one of our dentists actually, who is able to perform a magical therapy called NAM, or nasoalveolar molding, that really at the first week of life, after we meet the baby and mom has the baby, we can kind of put a little dental retainer in, which can actually make the cleft smaller, shape the nose, which from the surgeon's perspective makes things a lot easier for us and can actually lead to a lot better dental alignment later down the line. The dentist, and I want to underscore really the grateful generosity of Delta Dental Tennessee Smile 180 Board for really helping catapult our program to allow all of our practitioners to get state-of-the-art training at national meetings, but also provide this therapy, not just in Middle Tennessee, but even outreach to other parts of the state, which we'll talk about in a little bit. But basically, the kids, aside from seeing the surgeon, we have a comprehensive program where they can see an ear, nose, throat doctor if they need ear tubes, any speech concerns that come up, audiology, genetics, feeding, psychology, social work, neurosurgery, you name it. And orthodontia too is a big part of our program, where these kids are even on a dental chair or orthodontist chair, probably more than they see the surgeon, quite honestly, because they may need that initial therapy to make the cleft smaller. Then they may need a palatal expander. They may need sort of headgear, and then obviously traditional braces. But well beyond that, a certain proportion of our kids will need a jaw surgery to fix their kind of massive underbites, typically, or kind of underbites, overbites, things like that. So it's incredibly important to us to establish our relationship up front, but then throughout the years, they will see kind of these different providers in our team setting here at Vanderbilt, just 2 floors below me, where we have everybody come together at these different touch points throughout their growth.
Talk about why that collaborative approach is so important, because I think in many cases as a family, you can get very confused and very, intimidated having to go to a lot of different places. And in your case, you're saying, hey, we're going to kind of wrap our arms fully around you, holistic opportunity, just like you're talking about, to bring all the best in class, the specialists, the expertise, and really kind of help in one place guide you through this process. So talk about the collaborative approach and why that's so important, especially in these very complex cases.
Mm-hmm. Yeah, especially in these complex cases, but even in the simple bread and butter ones, because again, I think we're coming at it from 2 fronts. One, we really want to provide like a world-class kind of medical surgical experience, number one, in terms of providing evidence-based care that's state-of-the-art, obviously. But number 2, on that same front, we realize that these families are traveling large distances to see us. They're oftentimes schlepping their kids through the Vanderbilt parking lot, up the parking deck, as you may know, and through the elevators, and it's a long day. Now, we have set up a system where it's one-stop shopping, if you will. So the way our team works is they bring the child in, the patient, and on that one day, they're seeing everybody in one day, rather than take multiple days of work off or arrange childcare. And being as a dad myself, I mean, we know that, and as having kids ourselves, how hard it is just to take that 1 hour to go see a doctor's appointment. But if you have to do 10 of those in a year, that's a lot. And so we realize the burden that is on our families. And so it's not only about providing like our best surgical plan and saying, hey, this is it, go figure it out. That's why we have social workers. We have kind of resources around to really help facilitate the family making it to those appointments, to get all the questions answered and seeing all the folks, the doctors and the providers that they need to see that day. Because oftentimes siblings are there, and we're trying to really create a great family experience too, being sensitive to not only the child and the parents, but also the siblings too that come into it too, of having their brother or sister affected with a cleft or craniosynostosis or any of the other things that we deal with. So really, we want to create that kind of warm, inviting, atmosphere to kind of create, if you will, unreasonable hospitality, or that kind of, to use a restaurant analogy in the restaurant world. We really want to go above and beyond in that kind of domain as well. Just knowing how hard it is to kind of come in and spend a 5-hour visit, at a doctor's visit, which is a more unusual thing. But most of our families, I think the vast majority, find it well worth it.
You mentioned expanding out, and so working even beyond Tennessee. Talk about expansion and what that means.
Yeah, absolutely. So I think there's obviously a few key centers in the state and in our kind of southeast region that provide kind of accredited care. So we have an accrediting body that it's called ACPA, American Cleft Palate Craniofacial Association, that we go to our national meeting. And again, through the generosity of Delta Dental, we're able to get all our team members there to kind of where our audiologist is getting state-of-art audiology, our dentist is learning the state-of-the-art dental techniques, and they're networking with national experts in the field to really bring that evidence-based approach back here to Nashville. We want to spread that out and kind of be able to provide that kind of excellence of care to the entire region, essentially, destination care, if you will. And so I think as we're reaching out, we now have obviously our clinics here in Nashville, at Monroe Carell, and also Murfreesboro, about 35 minutes south. Recently, Dr. Matt Pontel, who joined us from Children's Hospital of Philadelphia, where he completed fellowship, is out, has a once a month clinic in Jackson. So he's out there. And myself and Dr. Isabella Galden, who also does cleft and pediatric hand, we started a clinic in Madison, Alabama, knowing that a lot of our patients come from that Huntsville kind of area. In the future, we're looking out east, perhaps to the Cookeville area too, but we want to kind of basically branch out to kind of shorten that distance and kind of, again, burden of care for families coming in to see us in Central Tennessee, because we know the traffic isn't getting better right now in Tennessee, or in Nashville, but we'll hopefully see how that goes. So, yeah.
Well, we've said it both throughout. Delta Dental of Tennessee, the Smile 180 Foundation. Talk about their investment, what that means to you in the program, but then tied into how can other businesses, how can the community help further your efforts?
Yeah. Oh, and let me touch on one thing too about the collaboration you mentioned. So why that's important is because sometimes these cases aren't cut and dry, right? In terms of a complexity that a kid has or a nuance, or oftentimes kids and families will move from other parts of the country. As we know, like we're a rapidly growing state and city. And so sometimes, kids will just kind of come in a team with kind of different things going on. And really, I can't underscore the value of that collaboration between, us and the different specialties, all getting around the table and talking about that one kid together, not like over email or kind of this and that with that administrative churn. After the team day meetings, the clinics, we have a meeting at the end of the day. It's a continuing medical education conference, actually, where we sit around a round table and put up the picture of the kid and the different images, dental x-rays, for example, CT scans, and go around and discuss that those complex cases. And that does two things. One, it allows kind of all of us to come to a consensus about the best plan of care, which is then delivered back to the primary referring provider and the family. And then number two, it allows us also to kind of generate research ideas, if you will, and have that collaboration at an academic level about, oh, hey, I've seen a bunch of these kids. What would you do with this? Or what's the approach to this? So it allows us to kind of get better with that hybrid vigor as a team. And so dovetailing onto that, what Delta Dental has done is kind of really taken that collaboration to a next level. And what I mean by that is that I mentioned that kind of our ACPA national accrediting body or association, we're all members, but not all of our team members can kind of, they may not have departmental support to kind of send them out and, basically spend a couple $1,000 to send them to a national meeting like a surgery department might. So we wanted to level the playing field. So we send our research assistants, we send the dental assistants out there. We would send kind of providers at Monroe Carell who would otherwise have no means to really go there on their own, because we think it's important to, number one, have that team camaraderie, but also two, really enrich that collaboration off campus too, when we're not taking direct care of patients, but we're learning about how to take care of patients. And that's what things that the Delta Dental kind of endowment has really done for us too. Besides some obviously physical things, like we've been able to get a cone beam CT here in the clinic, which allows us to take high resolution dental images on site at point of care, corner contact. So that community involvement has been huge. Another massive thing where we've really tried to enrich the community is we have our kind of annual family fun day. That's at the Nashville Zoo. We had our second annual one this past summer. Is very hot. We may do it in September next year. But anyway, July at noon may not be the ideal time to do this, even under a tent in the Nashville Zoo. But we had over 200 families participate. It was an amazing experience. Again, this is due to, the philanthropic support of our community members. And so we're just trying to build on that to bring more community into the fold. That will help things like outreach. That's what we'll be looking for from other community folks that want to help. Kind of amplifying our research program too, as we're now getting involved. We have a couple NIH grants that we're actively participating in that are really trying to study these conditions at a very deep level. And so kind of the support from the community helps us kind of achieve those goals.
When you look at the transformation that you're able to create, provide, what that means for the child, for the family, when you look at the growth of the program, the expansion, and what that means to be able to, bless more families, more children, what puts a smile on your face to see where you were and how far you've come, and yet the impact you can have?
Man, that's a really fun question. As we're coming up to Halloween, too, like one thing I always think about is kind of, what kids are dressing up and just kind of keeps it, fun and light during this time of year. But one of the most enjoyable kind of patients that kind of gives us that satisfaction is really seeing a child with the cleft that we maybe met prenatally in the womb, and then now seeing them as a teenager and learning about what do they want to do in life? What are their aspirations? Where are they going to college? What do they want to study? And man, that is like one of the most fun, just super satisfying parts of that teenage group, like seeing that through that whole journey and all the surgeries that they may have had, and just watching them go through middle school and that phase that's awkward for everybody, right? Going through middle school and puberty, but just seeing them kind of succeed and kind of own it in life and kind of want to give back, seeing those kids want to give back, saying, hey, I want to be a nurse, or I want to be a plastic surgeon, or hey, I want to come volunteer with you guys and help other kids. That is like the most gratifying, I think, part of our job, really. So it's really a fun way to see our kind of teenagers grow up and kind of leave our midst, but in a good way.
Absolutely, that's amazing. Yeah. We'll wrap up with website, contact information. Where do we go to learn more, to get involved? Where do we go?
So obviously you can go to our kind of Monroe Carell children's website, or Cleft Craniofacial Program. We have a great craniofacial cleft coordinator. Jennifer Tilton is her name. But we have a general email address, peds.cleftcraniofacial@VUMC. We can probably integrate that back into the chat. And that's the best way if there's any questions about referrals, any questions about really anything. That's just a general hotline to us to find us.
That makes it easy. Well, Dr. Golinko, thank you for all you and your amazing team are doing to power the good. Thank you for coming on the show.
Okay. Thank you so much, Jeremy. Thanks to the listeners too. Appreciate it.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.